Hello, everyone. I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another entry in our EHR telehealth series where we dive into the telehealth features of various EHR vendors. Today, we're excited to sit down with Tim Costantino. He's VP and head of product at AdvancedMD. Welcome, Tim.
Awesome. Thanks, John. Glad to be here.
Yeah, so I'm excited to learn more about AdvancedMD. I always love these deep dives into telehealth since, our worlds have been turned upside down when it comes to telehealth. But before we dive into that, tell us a little bit about yourself and AdvancedMD.
Yeah, sure, John. So as you mentioned, my name is Tim Costantino. I'm VP of Head of Product here at AdvancedMD. I come from a product technology healthcare background. I have three amazing kids, a cute dog, which you might see run into the camera at some point during the interview today. A wonderful physician wife, so healthcare is definitely in the family.
Oh,
And
wow.
we live in Salt Lake City, Utah. From an AdvancedMD perspective, we are a 100% cloud-based medical software platform. Our software is designed to help unify really all of the workflows within a practice. So you've got solutions for practice management, electronic health records, patient engagement. In short, our goal is to help just make our clients' lives simpler and easier so they can focus on better patient care.
Awesome. So, let's talk about what was AdvancedMD's view of telehealth pre-COVID-19, and then, how did that COVID-19 really change, and what did you accelerate, et cetera?
Yeah, that's a really great question. So AdvancedMD, I think, was really forward-thinking and proactive when it comes to telehealth. We really recognized early on that telehealth was really going to be a critical aspect of patient care in the future. We released our first telehealth product just about 5 years ago or so.
Wow.
So we were kind of leading edge in that respect. We obviously did not anticipate COVID or the public health crisis or
Nobody
public
did.
health emergency that came this year. But in that context, we are extremely thankful that we had a solution that our clients could jump to right away. Because really, I mean, that changed things within a weekend, right? Or within 2 weeks, everything was kind of flipped on its head. So we were super excited that we had something that was available, that we've been using for a while. I feel so, obviously COVID pushed the adoption of telehealth just through the roof overnight. What we're seeing now is that as practices get more comfortable with the workflows involved with telehealth, they're getting more comfortable with the technology, and they're getting more comfortable with the pros and cons. And as a result of that, practices are now figuring out what that new normal is going to be, right? So if you think about the normal adoption curve of any product, COVID just jumped it, right? It just
Sure.
accelerated everything. But what we really expect going forward is that telehealth is going to settle into a new critical normal, just normal way of taking care of patients. So from our perspective, in terms of how we adjusted when COVID first happened, we really took a very critical look and said, all right, what is critical right now from a product perspective, right? What do we need to focus on right now to help our clients be successful? And we certainly adjusted the roadmap, pretty significantly just to make sure that we could address all of the needs that were coming up as part of sort of the new normal of the COVID world.
Yeah, so you bring up a lot of interesting points. I mean, 5 years of all the interviews I've done, which, we're still relatively early in talking to all the HR vendors, but that certainly is the first one we've seen 5 years ago. I think of all the interviews I've done, that's a long time in the telehealth world. So that's pretty interesting. How well had adoption gone over those 5 years? I mean, was it just a trickle like most organizations, or or was there a decent amount of adoption in very specific areas? Any thoughts there or on the
Yeah,
numbers?
yeah, that's a really great question. I mean, I would say it was definitely a slow adoption early on. I think we were starting to see a lot more momentum really leading into 2020. We were seeing a lot more
Okay.
practices that were getting a little bit more specialized with telehealth and really trying to take advantage of the benefits of the telehealth model. So we were seeing more of that. So I would say the ramp up was starting to accelerate coming into 2021 or 2020. But then obviously when COVID happened, it just went through
Right.
the roof as the
Just
only
blew up.
option that was available.
It is amazing though how in many ways how simple people's approach was to telehealth pre-COVID, they essentially, most of them said, no, I just don't want to do it. I don't need it, right? And then when COVID hit, it became, I have to do it, so let's adopt it. And now, kind of as you described it, we're seeing this new normal of a much more sophisticated approach. When should I do it? With whom should I do it? What type of patient should I do it? What's the right workflow for it? When should I not do it? And they should definitely come into the office. So I think it's interesting to see that evolution. It's kind of you described it. So as you look at it, you guys decided to develop your own in-house telehealth solution. You are, it sounds like, leveraging Zoom, but what went into that choice to kind of develop your own telehealth solution? 5 years ago, there were quite a few telehealth solutions out there. You could have just partnered with them rather than building it in-house. What was your thinking there?
Yeah. So I think, one of our core beliefs is that for the core functions that a practice needs to be successful, those core functions are significantly improved when they are part of a unified and frictionless experience. So whenever we evaluate a product offering or a service, some of the key questions that we ask ourselves are, will this become critical to the practice? Like, will this become just part of the day-to-day functioning of a practice? If the answer to that question is yes, then we look at investing and we look at how do we integrate this fully into the workflows, right? Because you think about telehealth, I mean, it's integrated into the scheduler, it's integrated into the PM, it's integrated into the EHR, obviously, it's integrated into the patient engagement and the outreach. And so when we looked at it, we said, that's really something that's core and something that we should be investing in as a strategic differentiator and as a strategic really function that we think practices are going to need and expect going forward. And again, I think AdvancedMD as an organization, I think was pretty forward-looking in that respect when we started that process 5 years ago. And I'm thankful that we were, because COVID happened overnight, and something like that happens overnight, you don't have time to build. So I'm
No,
glad that it was there.
there was a fair bit of scrambling from a lot of vendors, but you were well positioned in that regard. It is interesting to think about, I think it is core to every, can you imagine someone buying another EHR and not evaluating what telehealth options they have if they decide to switch EHRs? I mean, to me, that illustrates why it's core. I think it is interesting, that you chose Zoom. Any insights into why you chose Zoom? Not that anyone has built the video stuff themselves. Everyone I've talked to is using some sort of third-party partner or open source solution, et cetera, right? So what were your thoughts on Zoom and what went into that decision?
Yeah, it's a great question. So I think, I mean, in terms of why to pick a partner, I kind of look at it as, the video conferencing aspect of telehealth is what I call sort of the last mile, right? That last mile is not something that EHRs and practice management solutions and patient engagement solutions are really going to differentiate themselves on, right? It's a capability that's now available by a lot of different vendors that are out there. So for that reason, we said, all right, that's not something that we want to invest in, right? We don't want to invest in that last mile. We want to invest in all of the integrations and the workflow aspects within the EHR. Specifically why we chose Zoom, we went through a pretty robust analysis, and at the time, Zoom was one of the few that was actually HIPAA compliant. And the amount of features and functionalities that they supported within that sort of last mile experience was really one of the most robust offerings at the time that we really needed in order to offer a full telehealth solution. So that's why we chose them.
Yeah. It's interesting to think about the integration with video and not building your own, because it's like you didn't go and build your own database, right? You use some sort of database provider. It's kind of similar, though ironically, many of the legacy EHR vendors did build their own database because they're 30 or 50 years old. So there's a certain irony of mumps and cash in there as well. But anyway, that's a kind of sidebar comment. But it's interesting. You talked about EHR integrations with telehealth and the importance of that. What's available today, and what are you still in the process of building, between your telehealth product and the EHR? And to me, in many ways, it's more the PM or even the patient portal of things.
Yeah, that's a great question. So I mean, right now, Right now, our telehealth solution is, it's fully embedded into the product, right? It is just another piece of the product. But since COVID and since we've really, again, since the usage has really gone off the charts, we've been doing a lot of deep dives with our clients to really understand what is the best workflow? Like, what's the best workflow all the way from the practice management perspective leading to the patient, but then also what's the best workflow from the patient's perspective coming in. So we've been doing a ton of work from a user experience perspective and a client validation perspective to really figure out how can we streamline that workflow now, right? So that's where a lot of our focus is going forward. How do we make that EHR experience as easy and quick as possible, right? We don't want the physician to have to go to two different areas within the product in order to launch the EHR or to launch the telehealth visit, right? Everything should be right there, fully integrated, so they can just take the notes, they can see the patient. It's all just one clean experience. So fortunately, we had a lot of that just out of the gates, but now we're really trying to take that to the next level now that the adoption rate has increased so quickly.
Makes sense. And obviously, there's a lot of compelling reasons for a user to use an integrated solution, telehealth solution from you. But we definitely have seen a lot of organizations that already had a telehealth solution, or maybe they preferred something else because they want to do some direct-to-consumer stuff, or there's a lot of different reasons why they may have already chosen a telehealth vendor or prefer a different telehealth vendor to your solution. How would you approach those third-party telehealth vendors? Especially a customer that wants to use one of those third-party vendors. How do you approach the integration with that? Do you have the APIs, or are you more, I've seen all sorts of integrations exporting CSV files from appointment schedules, and how do you guys approach the integration with third-party telehealth vendors?
Yeah, so we believe in a really robust marketplace. The value that you get in the marketplace from the competition, the innovation, just the value-added tools and services that you get from a marketplace, that's not possible within the walls of one single organization, right? So for that reason, we have full sets of APIs so that anybody that wants to be part of the marketplace can integrate via APIs and really do fairly deep integration via that methodology and quick integration too, right? Don't need to worry about throwing files around and all those types of things, right? It's just right there at your fingertips, real time, etc. So we are very open to anybody that is interested in becoming part of the marketplace, and I would encourage really any vendor that's out there to reach out to us directly, and we can start those conversations.
Yeah. So I think my next series after I finish the telehealth one might be a marketplace API integration series. Anyway,
that would be a good
something
series
to come for the future. Yeah, but there's so many details we could talk about, right? What is really available is read versus write, and all of those things. So anyway, future series. I like it. So let's do what I call our feature lightning round. Really kind of asking you a whole set of features and saying, do you offer this? No, yes, no. We use a partner, etc. So, interestingly, in this series, we found that there's a whole spectrum of ones that might apply to a third-party telehealth vendor, but with an EHR, they're almost stupid to ask. So I'll go through them and you can tell me, Tim, if I'm wrong on these. But for example, HIPAA compliant. Of course, if you weren't, you should not be an EHR vendor. Go away, right? Like, of course, you're HIPAA compliant. Audit logs, it's similar. It's integrated with the EHR. You've been auditing, have all sorts of audit logs. Could probably do a whole series on audit logs. But automated patient reminders, you are doing that for the in-person visits in an EHR. So you have the same functionality built in for telehealth. It sounds like nothing necessarily unique beyond that. Patient education, if you were doing patient education in your EHR, you have it available now. I assume that's the approach on those. And then same with patient payment. Obviously, you've been collecting patient payments. You can do it through that as well. Is that fair to say?
Very fair. Yep, we have all those things covered.
All right, so let's dive into the other ones that I think kind of differentiate various implementations. First up is custom branding, and I kind of see it from a couple angles. One is, kind of the branding on the telehealth portal, if you will, but also in the communication and, what's available there.
Yeah. So yes, we have custom branding. That's been really important to us, really from the very beginning, from the patient portal perspective, really to any communication that's coming directly from the practice out to the patients. Patients, really don't need to know about AdvancedMD. We're not trying to create a brand that's patient facing. So we have pretty robust capabilities from a custom branding perspective within the patient portal to outgoing communications, really across the entire sort of interactions that might exist with the patient.
Great. How about telehealth appointment scheduling?
Yep, fully embedded.
So is it just a checkbox that says, oh, this is a telehealth versus in person, or I assume it's integrated with your regular appointment scheduler, right?
Yeah, fully embedded with the regular appointment scheduler. And we have some really exciting things coming out soon with some future releases actually to help really improve that overall workflow. But yes, telehealth appointment scheduling is fully baked in right now, and we're going to give some more flexibility, some more options coming soon.
You're gonna break some news on we won't push it too hard. They can have something to look forward to. But yeah, it makes sense to do it. How about patient self-scheduling?
Yeah, that's the other just really important aspect of it. We certainly have that. One of the things that's come up as part of COVID, but really has been a trend for a long time, is how do you make the entire interaction as efficient and streamlined as possible? How do you give the patient the tools that they want in order to manage their own care and take care of their own schedules? So the ability to do patient self-scheduling is something that we've had for a while and is fully embedded with our telemed solution as well.
And do they have to go through the portal, or how do you approach this patient self-scheduling?
Yeah, it's through it's through the portal, but they could do it in either a authenticated mechanism, so they already have an account set up, or they can do it as sort of an unauthenticated mechanism, especially if they're a new patient to the practice and
Sure.
it's part of an intake process. So you have a pretty robust intake workflow that enables the practice to ask specific questions, really analyze sort of what type of patient they are, which then gets added into a workflow process that the practice can then manage. So we've got pretty robust tooling on that side to help support really both those modalities, both new patients as well as existing patients.
Yeah, that's a good differentiation. How about asynchronous text messaging with patients? Most people call it secure text. How are you approaching that?
Yeah, so this is one that we have partially right now. We've really tried to focus primarily on sort of the automated messaging, automated reminders, automated communication, because we feel like, I mean, it's a real opportunity to help streamline the best practices from a messaging perspective. But we are excited about some additional features and functionality coming out to support sort of the asynchronous aspect of sort of two-way texting and two-way communication. So those are some things we have on the roadmap for the future.
Nice. And I'm sure they can still send messages through portal and things like that as well.
Most definitely, yep, yep. Fully support
But
messaging directly in the portal.
but where portal messages go to die, right? Not fully. Okay, I won't hammer the portal too bad, but text is better. How about real-time text chat during the visit? Is there the opportunity to be able to, share links or have that discussion or say, hey, your mic's not working. Here's how to do it. Have you done the real-time text message during the visit?
Yes. So directly in the visit, there's a chat area. So we've got two-way communications, texting directly in the visit. Unfortunately, what we've seen is the challenges with getting connected to a visit and knowing how to use the audio and those types of things have been coming down as patients gain more experience using the system as
Sure.
well. But yes, we've got fully supported two-way communications within the visit.
Sure. Ideally, it's more about sharing not patient info, but like patient education links or a link to an image to illustrate what's happening with their condition or resources, etc. But yeah, in the meantime, I actually love it because they can use it however they want, which is a powerful thing as well.
Yeah,
Um,
most definitely. Yeah.
so it's a good feature, and a lot of people don't have it, so that's great that you do. How about web-based versus app-based? And there's kind of two perspectives on this from the clinician side and the patient side. How have you guys approached it?
Yeah. So it's kind of a combination of the two. It's primarily app-based. Uh, we the primary way for patients to enter into the meeting is via the Zoom client, which we have fully integrated as part of the links that go out as part of the scheduling of the appointment. But there is capabilities of doing sort of an embedded video as well. But right now it's primarily via the app.
Okay. But the Zoom client can work on a desktop or a phone, or it can work through any, right?
Exactly. Yeah, it works right on the phone, right in the desktop. Really, whichever client the patient has, they can leverage. And that's really, I mean, that's a key aspect of just reducing the overall friction with the experience, right? We want it to be as easy, as seamless, as physically possible for the patient. We don't want anybody to have to think about the technology. I mean, I think that's the key. That's the goal that we're all trying to achieve. The technology should just it should blend into the background, right? It's really all about the patient care and that interaction with the physician. So we've really focused a lot on that workflow to just help make that as streamlined and easy as possible. So no matter what client the patient has or even the physician has, they can get on and join the meeting as seamless as possible.
I was going to say the experience is the same for the physician or the clinician that's doing it. They just download the Zoom client and connect as well, right?
Yeah. Yep.
Yeah. I mean, once you've done that once, I think we're all familiar with Zoom now. The only question is, does the patient come up and it says Sally, even though it's me? I don't know if you've been there on some of those, but anyway, it's a small issue. It doesn't really matter. So
there's definitely been a few meetings I've joined under my son's account. So those were not telehealth visits. Those were more school related visits. But yes, that has happened.
Yeah, you definitely click the box that says "Don't remember me," my name. That's worth it. Cool. How about patient intake paperwork and being able to do the intake paperwork electronically?
Yeah. Yeah, so all the intake paperwork, all the forms, those are all available sort of asynchronous and available ahead of the appointment. So again, that's really just kind of key to really streamlining that workflow. We want the patient to be able to complete those activities prior to getting into the appointment, and those get sent out automatically. So again, nothing that the providers need to worry about. And yeah, just sort of fully embedded in the process.
And I assume you were working on that even in in-person visits. It's kind of the same technology applied to both.
Exactly. Yeah, I think the unique element that's come up with telehealth is making those forms available directly within the waiting room of the visit. So they're already available within the portal. They're already available via messaging that goes out prior. So some of the areas where we're seeing a lot of advancements now is making them available so that when you're in the waiting room, if you show up early, it can say, hey, guess what? You've already completed these ones, so you're ready to go. Or hey, we found that you're missing this one. Click here, and then you can complete it while you're waiting for the provider to join. So those are some of the newer enhancements that we're seeing coming down the pipe.
Wait, so you mean patients won't always fill out the forms before they come to the office? Yeah, okay. Fair enough. No, that's actually a great feature. I hadn't seen anyone point it out because it is a good point. If they haven't filled out the forms, how do you do that virtually and ensure that that's done before the doctor comes in, because they often need that form? And I imagine you do digital signatures as well, and having the HIPAA privacy notice signed, et cetera, is pretty important before they visit. So.
Yep, most definitely.
Yeah, that's great. And speaking of that, it sounds like you guys do have, or maybe how are you approaching the virtual waiting room and really kind of that whole telehealth workflow? How do you manage? And I wrote a piece actually recently about this, just talking about, before the workflow in an in-person visit was see the front desk, go to the nurse, and the nurse brings you back and does an intake, and then it goes to the doctor, and then sometimes it goes back to the nurse, and then sometimes it goes back to the doctor, and then the nurse, and then you go to the front desk, right? And it seems like that's I think the next year we're going to figure out what the right workflow is telehealth. But what options do you have available today to be able to do that? If the MA or nurse needs to see them versus the doctor, how do you approach that?
Yeah, that's a great question. I think that's an area definitely for innovation just within the overall telehealth community. So right now we have a virtual waiting room. already in place, and it's just a place where the patient can join and wait for the physician. And when the physician joins, it starts back up. It starts right up. We support multiple providers or multiple care team members being part of that visit and being able to join the visit, so that they can address some of those workflow items sort of along the way with that one experience. But I really do see the virtual waiting room as an opportunity for innovation. The one, if they are in the virtual waiting room, how do you take advantage of that captive attention, right? How do you help the patient while they're there, paying attention to you, to help them have a better experience and a streamlined experience overall, right? So there's certainly opportunities there, but there are also opportunities to get rid of the virtual waiting room as well and make it a lot more on demand. There's a lot of workflows that are available in other places where you call in and you say, you think about calling in a help desk, right? Call in a help desk, and they say, all right, there's no one available right now, but how about we call you back when we're ready to go, right? And we expect, a 5-minute 5-minute wait time, right? Or 5 minutes till someone calls you back. So there's a lot of opportunities, I think, to move to more of an on-demand or sort of asynchronous start to the sessions that can really just help efficiencies both for the providers as well as for the patient. I think those are some innovative things that we'll start seeing throughout the industry going forward as well.
Yeah, I think it's the biggest area of innovation that's going to happen, is figuring out that workflow and what's the transfer and how, and you do have a captive audience with the patient. I mean, we used to watch the TV, which a whole industry of TV advertising, pharma, TV, was built around that waiting time. And so is that going to go into the virtual waiting room, or is the wait time just shorter? And because I'm in my home, I can go be distracted with my dog and my cell phone. And so maybe I'm not that captive. I don't know. It's going to be interesting to see how it evolves over the next little bit, and how much the wait times are going to be. That's
yeah.
Begs a lot of questions about in-person visits. If you can be on time for telehealth, why aren't you on time for in-person? But anyway, different discussion. Cool. So how about multilingual and remote interpretation? How are you? I mean, they're kind of two aspects, but how are you approaching both of those?
Yeah. So from an outgoing communications perspective, we do support multilingual messaging. So you can set up messages, the automated messages, to be in one language or another. So that's fully supported. In terms of like remote interpretation and real-time translation services, which are some of the newer things that are coming out. We don't have that now, but those are some things that we're looking at and we're really interested in, because it's, again, I mean, one of the big advantages of telehealth is that you can meet the patient where they are. So we're really trying to take advantage of that opportunity, right? And there's all kinds of cool technology things that you can do to help improve that experience. And I think multilingual sort of in remote real-time interpretation, those types of things are some pretty cool features that I think we'll see in the future.
Yeah, and the beauty, you kind of already pointed out our next feature, which is doing team-based sessions. In many cases, if you already can do the team-based session, you could always pull a interpreter into that session as a member of the team. We're seeing a real evolution there too about what is the team that I need to pull in. It's easy to say, oh, we need multiple doctors, or we need a nurse and a doctor, or whatever it might be, but having a remote interpreter, or having a caregiver, or a brother, or a mother, or whatever, right? It's interesting how that team really becomes interesting. And so it's great that you have those capabilities. How about integrated clinical documentation? You talked a little bit about it, but how deep do you guys go on that integration with the clinical documentation?
Yeah. So really, we want it to be from a provider perspective. I mean, right now, telehealth is fully embedded into the EHR, so it's right there, right? So our goal for that is to make that experience again as seamless and easy for the clinician, so that the clinician can continue to make eye contact and continue to have and build a relationship with the patient. Maybe as they're taking their notes, or their quick notes on the side. So we want that to be as quick and easy as possible, right? Like the absolute worst scenario would be, I'm having a conversation with you, and then I got to switch over to this other monitor over here because I got this thing over here, right? I mean, we're trying to help keep that connection live and active throughout the entire encounter, really. So we have that today, and those are some areas that we're really looking to improve and really just make better as part of the fully integrated, fully embedded telehealth experience across the whole continuum of care. So we're pretty excited about what we have there now, but we're also really excited about some of the improvements and sort of workflow tweaks we can do going forward to help make that even more seamless.
How about ambient clinical voice? That's my favorite technology. Anyway, have you looked into that and how that's going to apply, or where are you at on that?
Yeah, we have some of that already enabled or already possible as part of our mobile doc solution within our app. But with telehealth, that obviously opens up the opportunity even more, right? So we are very, very excited about that technology. I think there's a lot of opportunities to leverage that to again help make the provider's life so much easier, right? If
Exactly.
there's technology behind the scenes that's just listening and recording and documenting everything that the physician would need to document. That's just another streamlining function to help that physician give all of their attention to the patient, right? You know that the ambient technology will, we're far away, I think, from it completely taking over all the documentation side of things, right?
Uh-huh.
But if they can just get half of it or most of it, so that to
Right.
the point where the physician just needs to review it and sign off and make sure that it's valid, or maybe add some additional notes, like those types of things, like summarizing and those types of things, that would be a significant improvement and benefit to the providers that are using the system.
Yeah, I mean, even if it could do the granular data and then the doctor adds the narrative or whatever it might be,
Yes.
that would
Yeah.
be a huge savings. So, and I
Exactly.
agree. I think telehealth is that opportunity to really, blow that up in a way that,
Yeah.
the idea of putting microphones in the room, that's a heavy lift, but just applying it
Yeah.
to telehealth and it's a switch on, switch off. That's a powerful thing if the technology can catch up enough, right, and
Yeah.
be effective enough. I think that's the other
Yeah.
problem.
I
So
really like the word that you used, ambient. I mean, I think that's the right word to use to kind of describe sort of the experience that we're going for, right? When we
yeah,
look at that going forward, I think it's a really appropriate word for that.
yeah. Yeah. Hopefully it comes sooner than later. How
Yes.
about screen image capture? How are you approaching that? If they hold up their wound or things like that, are you able to capture the screen? Of course, everyone can do print screen, but have you integrated that functionality?
Yep, that is integrated in part of the overall telehealth solution. Yes.
Awesome. And then since you're using Zoom, I think I know the answer to screen share is available if they want to share their screen.
Yep, that is correct. Yep.
Yep. And how about post-visit patient ratings, reviews, surveys, which, there's a lot of ways to take this one, of course. One is just the internal survey. The other one might be some sort of rating review on a third-party site. How are you guys approaching that?
Yeah. So we actually have another full module that's been in existence for a while around reputation management. So we have all that sort of already built in from a workflow perspective, so it can automatically send out requests for feedback and requests for reviews, and so that's fully embedded in the overall solution.
Right. And how about any telehealth specific billing or verification? Have you done anything specific? I mean, obviously, telehealth has the reimbursement side has changed quickly. What kind of work have you done on that side to help them facilitate it?
Yeah. So unfortunately, uh, all of the all of the features and functionalities that would be needed in order to support telehealth specific billing, something that we really had within our practice management all along. So that's just been part of the solution from the beginning of the product. So there really wasn't anything new that was needed to be done as part of COVID, as an example, with the exception of just making sure that we had all the appropriate codes and training and documentation in terms of how to use the codes and what the codes mean. Making sure that we have processes in place to deal with the recruitment processes that are coming out as part of Medicaid right now. So from our perspective, a lot of that's been just really on the education side of things, right? How do we make sure that our clients really know how to use the system and know how to do the proper billing, because there has been a lot of changes with that as part of the the public health emergency. So that's really where a lot of our focus has been, I think, as part of COVID.
Makes sense. Cool. Well, thanks for going through the features. I guess, just one question to kind of wrap up this discussion, but what do you see the role of telehealth that, in the growth of the business at AdvancedMD? I think it's interesting you started 5 years ago and said, yeah, we need to have this as part of it. But how is this going to be approached going forward for AdvancedMD?
Yeah. So, we really believe that telehealth will continue to be a core component of patient care. Um, it's going to be a new normal. It won't be the exact peak that we experienced when COVID, when telehealth was the only option, but it will become a core component of that patient care going forward. So as a result, we treat it that way from a product line perspective as well. We're going to continue to invest in telehealth. We see it as a core aspect of both our clinical and patient engagement product lines. Um, we believe that the best telehealth solutions will be fully integrated across the workflows across the board. So when we look at how we prioritize things within our telehealth product, it's a lot of, all right, what do we need to do to make this a streamlined, unified workflow from the PM to the EHR to the PE? And that's where a lot of our focus is right now, the UX around that experience, the workflow around that experience. And that's something that we're gonna continue to invest in going forward, to make sure that that core component that all of the practices are going to expect going forward, to varying degrees depending on specialty, but still a necessary and key component. So it's going to be an exciting area, I think, for innovation for us and investment for us, and just a key part of the overall offering going forward.
Yeah, and it's nice to finally invest in something that people are going to use. So the adoption's increased, right? I think it is an exciting area. I'm interested to see, will this become a differentiating factor of why people switch EHR vendors even? Is that going to be part of the discussion? We had that happen with meaningful use. Will we have the same thing happen with telehealth? I don't know. I mean, certainly switching EHRs is tough, but is the telehealth going to become that important and have an integrated experience? Maybe. So, thanks
Yeah,
so much, Tim, for sharing your perspectives from AdvancedMD and what you guys are offering. I appreciate you taking the time. Thanks everyone for watching. If you want to find the rest of the EHR telehealth series, be sure to check it out at healthcareittoday.com. Thanks, Tim.
awesome. Thank you. Appreciate it, John.